Infant security and alarms, how alarm fatigue impacts infant safety. Nurses have many important jobs, but one of the most important is maintaining the safety of infants, as they lack the means to defend or protect themselves. Between 1983 and 2015, 132 infants were abducted from healthcare facilities in the United States, 5 of which were never recovered. Though this number may sound small, even one infant abduction is too many. Most often, infants are targeted in the hospital setting. It was reported in 2015 that 45% of all infant abductions occur in healthcare facilities, and most often, infants are taken from the mother's hospital room. For these reasons, the Joint Commission mandates that healthcare facilities identify and implement security measures that address the handling of infant abduction. Infant protection systems are a viable and noticeable means of protecting an infant from delivery to discharge. Having a locked unit to prevent access to strangers, appropriate ID badges for staff, and teaching parents about infant security are additional measures to assist with infant security. There is no question that there is a need for infant security on units where infants are located. Families who are involved with an infant abduction deal with an overwhelming amount of stress and trauma, which can easily be prevented by infant security systems, parent teaching, and staff persistence in adhering to policy. A common problem with the infant security system is frequent alarms. Common alarms include loose tag, tag tamper, and alarms when babies don't get admitted before 30 minutes after the ban is placed. Having an infant security system that works well with few false alarms that is viewed as a critical tool of the job creates buy-in from the staff and makes infant security systems more secure. When nurses are constantly annoyed with functionality of a system or frequent false alarms, they are not going to trust the system. These frequent false alarms can lead to alarm fatigue and pose a risk to infant security. Reports show that alarm fatigue occurs when staff members are exposed to a large number of alarms, causing sensory overload. When nurses are constantly responding to false infant security alarms, it can cause a slower response when a real alarm occurs and allows more time for the abductor to get away. As technology has advanced, the number of devices with alarms has multiplied. Unfortunately, studies have shown that 70 to 99% of alarms are false, causing alarms to be ignored, not heard, or for there to be a delay in response. Radio frequency identification infant security alarm systems have become the standard of care in most hospitals to prevent infant abduction, regardless of safety controls selected and implemented. Parents and staff must always understand that security and surveillance systems are not a substitute for continuous and personal vigilance toward infant security. Hospitals must prevent false activations of their infant abduction prevention systems. The first step is to create a committee with key stakeholders that are accountable, can work through organizational barriers, and understand the importance of decreasing false alarms. The second step is to conduct a thorough analysis with each preventable false alarm to determine if the alarm is due to human error or system error. One analysis revealed that 70% of the false alarms were due to human error from lack of training. 30% was technical issues. Once the analysis is completed and reported to the committee, training issues can be identified, standard work developed, and policies and procedures updated to reflect revisions. To address technical problems, the vendor should work with the committee members to address parameter issues that need to be revised, such as the reader's sensitivity level. Last, institutions must continue to collect alarm data monthly to report and discuss with the committee trending the outcomes. This plan supports JCAHO's 2016 alarm requirements. The umbilical tag is a straightforward solution. However, the umbilical tag is exclusive to the MyChild system. This would mean changing to new systems at a great expense. Since false alarms are known to occur because of lack of training, there would likely be an increase in alarms as staff went through training and became familiarized with the new system. Another suggested method is to make the use of Wi-Fi technology. The recent innovation is moving towards a Wi-Fi solution, which would offer a campus-wide solution versus the limited area of the RFID system. This technology would allow a much larger layer of protection. The ultimate goal is to take care of the patient, not care for the security system. Wi-Fi technology greatly widens the covered area that allows the facility to integrate multiple locations within the hospital and make use of real-time location systems. Wi-Fi technology provides a cost savings by taking advantage of the network already available in the facility. An alternative use of technology to reduce the number of false alarms and alarm fatigue would be to use Wi-Fi, radio frequency identification, and real-time location system technology in an environment that adjusts the sensitivity of the alarm based on the location within the hospital unit. The mother's room and nursery could be set to the least sensitive, a green level. The common areas within the center of the unit would be set at a more sensitive level designated yellow, As one got closer to the exit, the sensitivity would increase to the maximum, which would be a red level. Along with the sensitivity zones, the alarm would sound with a voice, not just a beep or flashing light on a monitor. The voice would announce the type of problem and the location. Using a voice for the alarm would differentiate it from other sounds on the unit, reducing the chance of the alarm being ignored because of alarm fatigue. Nurses must remember that they are ultimately responsible for the safety of the infant. Security systems are not a foolproof answer to preventing abductions. Nurses must never be lulled by a false sense of security. They must continue to respond to alarms and treat each one as if it were a true infant abduction, so as not to become desensitized and have disastrous consequences. Unit managers must continue ensuring that staff nurses are educated about the infant alarm systems. There is still a need to decrease the number of times the alarm goes off falsely. It will be exciting to see what the future holds for the new infant alarm security systems.